Is this care professionals being run off their feet, understaffed, making innocent mistakes, or is it something more sinister, perhaps?
I would say it's a combination of things. On busy wards, there's an awful lot for people to do. They might be looking after people who are rehabilitating, trying to get them home. At the same time, you're looking after people who are deteriorating. What we find is that not enough attention is given to training the professionals so that they can really communicate very well with the patients and really well with their families, so they can keep them fully informed and they can really meet their needs.
But we've heard in the past senior doctors claim that older people are being allowed to die sooner than they perhaps otherwise would to free up beds. We've also seen the controversy with things like the Liverpool care pathway as well.
Yes, I mean, this study launched today isn't saying that. I mean, that the Liverpool care pathway is a very controversial piece of guidance to hospitals, and in some cases it was really badly applied, and you hear terrible, just like on the film there, terrible stories about people just really not getting the care that they deserve at the end of their lives. It has been stopped in England now. It isn't used in hospitals anymore.
One of the facts that really leaps out from this study is that NHS staff told fewer than half of patients the end was near when they knew it was. But I suppose it's not an easy thing to do, even though they're health professionals. Talking about death doesn't come naturally to anyone, really.
It's a really hard thing to do, and that's why we think that people really need to be trained and mentored into this. It's a really difficult thing to do as part of your ordinary working day. But the other thing that we found in this research was that there wasn't enough specialist backup, specialist palliative care backup, so that those staff could have somebody to refer to or somebody to call on.
Yeah, not just backup, Imelda, but also it's not happening 7 days a week. Why are hospitals still in this idea, like the rest of us, that the week is between Monday and Friday and they have the weekend off? People die, people are ill all the time.
Exactly. And I think we more or less accept now that babies are born when babies need to be born, but we haven't adjusted our thinking to people will die when people need to die.
That is one of the recommendations. There are 10 that have been made in total. Is there going to be a follow-up investigation to see that these are being carried out?
Well, we certainly want this to be an annual report so that we can track and see whether improvements is coming. And also what you find in the report is that there's real variation. So some people are doing it really well and some people are doing it badly, and what we want to see is the worst are brought up to the standard of the best.